Hello, everybody. This is Lydia. A DMP scholarly project I might pursue is on improving hydration practices and reducing dehydration related side effects such as muscle cramping in high school athletes. On page 53, Terry 2023 lists 5 reasons for which a project can be exempt of an IRB review. Item number 2 is for research involving surveys and tests for which the participants cannot be identified. My proposed project would be focused on quality improvement strategies. It would focus on improving education interventions by showing data gathered from pre and post intervention anonymous surveys to assess knowledge and behavioral changes, as well as hydration tracking tools. This project can also comply with exempt review criteria of educational settings, as stated in Terry 2023, page 53. This education initiative will pose low risk and be performed in a non invasive manner. It will ensure that my project meets all the confidentiality protocols of the educational and healthcare systems. Looking ahead, I anticipate that my understanding of the IRB process will greatly influence my approach to project planning, data collection, and stakeholder communication. Knowing the IRB process ahead of time will ensure that my project is planned correctly and accordingly. I do anticipate that I will strive for an exempt project to ensure proper time management. Even though there is an expedited review process, I would be anxious about not meeting deadlines. Considering the WHO resource as a policy and decision making guide in an urgent care setting, I would implement the usage of an AI tool carefully, focusing on safety and ethical decision making. Because urgent care is often a fast paced environment, it tends to rely on technology for rapid decision making, making it a greatly susceptible system for wrongful AI utilization. AI tools in urgent care settings must assist healthcare and not impede clinical judgment or override clinician decisions. An important policy to implement can focus on ensuring that triage algorithms correctly prioritize patient care related to acuity and not overlook patients based on race, gender, or age. On page 26, the WHO resource speaks about human accountability to ensure that AI systems are performing assigned tasks correctly, and it highlights the importance of stakeholder involvement in ensuring systems are frequently reviewed. After watching Joy B's TED Talk on algorithm bias, I identified 2 examples that she used to illustrate how bias systems affect everyday decision making. The example that shocked me the most is how police departments are utilizing facial recognition tools for unregulated surveillance. If these tools fail to recognize all faces, it will lead to increased discrimination and possibly wrongful arrests. The second example that alarmed me is how Joy mentioned that some judges are now utilizing a machine generated risk score to determine imprisonment dates for individuals. It would be interesting to know what type of technology is utilized within such machines. Even though Joy did not mention healthcare specifically, some of the examples she mentioned can apply to healthcare, such as the facial recognition tool, which are now being utilized in healthcare settings more frequently. In an article by Katsanis et al. 2021, it is identified that facial imaging and recognition are being incorporated into healthcare settings, improving appointment check-in processes, matching patients accurately, and assisting with the diagnosis of some medical conditions. As Joy mentioned in her TED Talk, these systems are failing to recognize or analyze darker skinned patients. These systems can negatively impact an already marginalized community by failing to accurately verify patients' information, misreading facial expressions, and leading to misdiagnosis. Improvement of such tools is essential to decrease errors. AI bias must continue to be reviewed and raise awareness to decrease societal inequities. As Joy mentioned, auditing existing software is a great first step in bias recognition. Thank you all for listening.